Hi, everyone. Thank you for coming back to Cloudy with a Chance of Therapy. My name's Justin,
This is Kristen.
and we're here to just give a kind of a talk about mental health, therapy, and our lives in general. For those of you who saw the last episode, we had talked about kind of just a brief overview of communication and some things that work for us. Um, but I am, well, actually, more importantly, Kristen. Why should we listen to you about therapy?
Well, I'm a licensed therapist in the state of Ohio. I am provisionally licensed in the state of West Virginia. Um, but I've been a practicing counselor since I graduated pretty much in 2019.
Okay. And I'm just a guy who happens to be in the same room. Um, so today we were going to talk about anxiety and kind of go over kind of general anxiety and like overview the topics. And we had some questions from the our audiences from last week. Um, do you remember? Did you write down who gave you the questions?
Mm-hmm.
Okay. So, real quick before we get into that though, how's your week?
It's been warm. Um,
Yeah.
One of the things that it's important to kind of remember with mental health medication is some of them have a pretty drastic effect on how you're able to handle heat. For me specifically, I am on Paxil. Paxil affects my ability to regulate my temperature. For me, that means that once my body temperature gets up or gets down, it's very hard for it to bring it back to a sense of balance. Some medications can make it hard for you to sweat. Some make it more easy for you to get sunburned or sensitive to heat stroke because you don't sweat. So, as hot and as humid as it has been, it is really important to keep that in mind when outside. So things that we do, and also just for context, I am very fair. So I also sunburn really easy. We mitigate sun exposure as much as possible for me personally. So things like that, making sure I drink lots of Gatorade or other electrolyte drinks, things like that can also help.
That's excellent advice, but a bit more on a personal level. How's your week been?
Oh, uh, I've been streaming this week. I've had a couple of extra streams, um, just because we've been doing some time walking stuff. So on Sunday I did some time walking stuff on my warlock.
Yeah, you stream World of Warcraft right now. World of Warcraft, 3 days a week at least.
Oh yeah, at least 3 days a week. Sunday, Tuesday, Thursday. I recorded today, but I didn't stream it. Today's kind of been a rough, what I would refer to as a rough head day. Um,
Why was it a rough head day?
um, so my depression's been kind of, my formal diagnosis is I have generalized anxiety disorder and depression. So depression has been kind of making itself known. Um, and so that's been difficult. How did I describe it to you earlier? Just like there wasn't any energy in the tank.
Yeah, it's like everything's empty.
Yeah. And I'm just like physically and emotionally exhausted. And that can be a very common symptom of things like depression. We are going to talk about depression in one of the podcasts.
That's
But
probably in a couple weeks or so.
yeah,
Because I also have depression, so we are a great couple when both of us are going down.
yeah, Denver. But so my anxiety, like my depression is more, felt, I wouldn't necessarily call it self-harm. For me, I self-restrict when it comes to like food and things like that. Like it could be, and part of it is because my appetite simply just tanks. And I think part of what's kind of triggered this current depressive episode is I had my depot shot yesterday. And I only track my weight when I go to the doctor, and my weight didn't change. I actually went up a pound. And the whole reason why I don't track my weight at home is because that way lies monsters for
That
me.
that's one of your anxiety triggers, and a depression trigger, and an everything else trigger. Like,
Yeah.
it's just we had to get rid of our scales because we just both of us started to just kind of obsess over the number, um, to our own detriment.
Yeah. So,
Well, all right. So enough about the depression. That's for a later
yeah.
podcast. Um. So let's. And I've just been tooling around. You know, I am doing the job hunt thing, and so that's always been fun, especially with the depression.
Yeah.
Me
Yeah.
too. Yeah. But all right. So let's get into anxiety. So first off, before we do anything else, tell me what anxiety is.
Okay, so anxiety kind of as a general, like, we're going to refer to anxiety kind of as the umbrella. And anxiety refers to, can encompass a lot of different disorders. So generalized anxiety disorder is kind of like, hey, we know you have anxiety, but we don't know if it's trauma, we don't know if it's PTSD, we don't know exactly what it is. So we're just going to say it's generalized anxiety disorder. It's, we know it's there, we don't know what it is. Um, Other things that other and there are other other anxiety disorders like panic disorder. Panic is something that we're going to talk about a little bit today, kind of as a comparison or like a contrast to anxiety. um, you also have um, you have anxiety, you have panic, you have generalized anxiety disorder, you have PTSD, you have phobias. PTSD is post traumatic stress disorder. You have CPTSD, which is complex um, post traumatic stress disorder. Now, CPTSD is not considered, it's not a recognized disorder in the DSM 5, but it is a recognized disorder. And so, what that means is it is something that you would have as a comorbidity or along with another disorder. Um, so, it is something that a therapist, like, we would treat for complex PTSD, but it's not something that you could be, you're not going to get medication for it. So I hope that makes sense.
Real quick,
Hmm.
because we're going to use the term a lot, I bet. Define morbidity
Comorbidity.
or comorbidity or
So what comorbidity means, it's co-current. So things that typically go together. I'm going to look it up real quick because I want to be able to give the exact definition. Now I have to try and spell it. There we go. So, comorbidity is the simultaneous presence of two or more diseases, medical conditions, or disorders. So, things that commonly go together. And so, often you'll have anxiety and depression often go together. You will have like,
there's also like doesn't like ADD and autism share comorbidities or share
they share symptomology.
symptomology. Okay.
Yeah. So, it refer like, okay, so things like, I'm trying to think. So it's like panic and PTSD are common comorbidities of each other because um post traumatic stress disorder is you, it's the panic that happens after a traumatic event, which is exactly what it says on the 10. Um don't mind him, he's just going to cough. So, and it can be, again, physical, it can be mental health, it can be again, emotional things like that.
Okay, so let's talk about anxiety. Now we're gonna go to our first question. Do you remember who asked the first question?
This came from our listener Jen. She gave us a question, as well as um her housemates Ezra and Faith. So I don't know exactly who, which question is from which person, but it's their household.
So Jen, Ezra, and Faith, thank you for the question. Questions. So we're going to start at the top, which is what is the best way to deal with anxiety when you feel paralyzed, or how to deal with panic attacks in general. So we're asking about like people who have anxiety probably know what we're talking about, but people who don't. So first off, tell us about what that would be like. What's that talking about?
Okay, so anxiety. So anxiety versus panic. The biggest differences between anxiety and panic is onset, duration, triggers, and intensity. So, for example, a panic attack is going to come on quick. For me, it is this sudden, like I can't breathe. That's when somebody says, I feel like I'm dying, I feel like I'm having a heart attack. When someone ends up in the emergency room and they're having what they think is a heart attack and they're not, it ends up being a panic attack.
So for the layman looking on, a panic attack is that big obvious moment with the breathing and the
Yeah, the hyperventilation,
like
the
association and the crying and the big moment of acute problems.
yeah, not everybody disassociates.
Yeah, I know. I'm just
It can be it's more common with panic attacks versus an anxiety attack. So I kind of describe an anxiety attack as you kind of consistently feel like you're going up and down a bunny rabbit hill on a roller coaster, or that you have that big build up to the hill at the beginning of a roller coaster, but you don't go down. So you don't get that. There's no release. Like you might be able to get yourself back to, like, if we're looking at an anxiety scale, as a 0 is no anxiety and 10 is panic attack or an anxiety attack. Um, you might be oscillating. You might be going between 4. It might be like lower on the hill for you, and 6 or 8 may be closer to the top. And you just kind of like bop back and forth between those numbers. Like you never really get back to homeostasis, back to what is normal.
so anxiety is not just a acute moment. It's a like you're dealing with it over time, and you're just heightened. You're up there.
Yeah. Whereas a panic attack is kind of like being doused in ice cold water. It is instantaneous and it may last upwards of like 30 seconds to a minute to 5 to 10 minutes on the long end. So, and so when you have,
So, and one can lead to the other.
yes, one can lead to the other. If you are feeling anxious and you are staying in that anxious place of, like, staying in that ramped up place for an extended period of time, um it can lead you to have a panic attack. Our bodies can only really sustain that level of strain for so much before it just basically it's like it needs a reboot. And by reboot I don't mean you're going to pass out. You're not going to hyperventilate until you pass out. Like you might get lightheaded. um and it can trigger what's called a vasovagal response, which is so you have the vasovagal nerve is a nerve that runs through the top of the head to the bottom of the body. And that's like when somebody has a shot or they get blood work done, and they go limp. That's the nerve that's involved in that. Um, but
Generally, it's going to be so an anxiety attack is an extended period of some minutes or possibly hours, depending on how things
yeah.
are going down, or maybe even like, would you have an anxiety attack for days, or would you have,
Well,
or would you be?
I'm going to bounce that question back to you. Do Because when I'm in the throes of being in that elevated status, it's really hard for me to kind of have a good frame of reference for the amount of time that's passed.
There have definitely been times where like you'll never get back down to zero. Like you just stay, you might get down to 2, but never quite zero, and that can last for a while, like a good bit. Like you're not often like you're not always like you're not gonna be like a week hanging out between 4 and 7. Although that has happened before, but there were external factors. um, but it was like, yeah, you're down. You might get down to a 2, and like that's why I said it's like I told you that like you've been having an anxiety attack for 4 days now.
Yeah.
You know,
And typically it'll culminate in a what we refer to as it'll culminate in a full-blown panic attack eventually.
so as now as the person watching, I've seen you go like Basically, you'll be high anxiety for days, and like every night you have a like the moment you relax a little bit, you go
Mhm.
to bed, you have a panic attack.
Yeah.
Um, those panic attacks during that state are usually the heavy ones,
Yeah.
like the
So, person outside looking in, how would you like what? How would you differentiate those types of panic attacks?
well. All right, so you like an Eskimo defining multiple varieties of snow. When you live with it, you kind of have to define it. So you have what I would call little panic attacks, which are just you have a couple of 10 minutes where suddenly you're breathing heavy, you're looking around a lot, and I like those are like the I'm being hunted panic attacks. Not you're actively in danger, but someone is hunting you is what it looks like you've gone into. Like you're then you have the um, tears and crying and like lots of breathing, but I can usually get you to come down for it pretty easy. And then you have like level three, where we've got tears and crying, and like you're just not able to come down. Like we have to go through the breathing exercises like 3 or 4 times, and then there's the full disassociative, where it's like at that point I have to be like sometimes I have to pinch you, sometimes I have to touch you or talk to you for a while, sometimes I have to be like, hey, like nudge your shoulder, to get you to just acknowledge that I'm in the room talking to you. I usually like poke you like you had one the other day. And I didn't do it hard. I wasn't trying to hurt you much. I was just trying to get your attention, but it was like kind of pinching your arm and be like, hey, can you look at me?
Mhm.
I need you to look me in the eyes. Those are like the big ones. They're much more rare, usually, when things are going well, but they still happen. So yeah, you have like 4 levels of panic attack. And I don't know how universal that is. I've not really dealt with anybody else's panic attacks.
Yeah. And I would and what he's describing is really the difference between an anxiety attack and a panic attack. So those first two I would kind of say are more anxiety attacks where I'm having a spike and we can work through them. Now I don't have them anymore. I haven't had one in a really long time. Probably since we moved out of the townhouse.
What?
The energy ones, the ones where I had that just what I refer to as energy and potential, where I would have a panic attack and I had to do something with the energy or like
Oh yeah, when you get like
I
that's
clean
when you have
manically.
that's when you have a panic attack and suddenly one room of the house is a lot cleaner.
Yeah.
Just because you needed something to do. Um, like, and I always kind of feel bad because like those are super helpful panic attacks sometimes or anxiety attacks, but they're always bad for you. And like, I
Yeah,
just end up as guy watching. I always kind of laugh, be like, "Hey, honey, I need you to stop cleaning for a moment."
right. But it is legitimately sometimes people with ADHD have them, sometimes people with like other forms of anxiety have them. But it's the best way to describe it is energy and potential. It's that energy has to go somewhere. In some cases, it can go into self harm. In other cases, it can go into other things. But the key is to make sure that it um, isn't going to be detrimental. So I think that that's kind of something to remember is that anxiety and panic can represent like can appear as different things for different people.
So okay, let's talk about that first question. How do you deal? What is the best way to deal with anxiety when you feel paralyzed, or how to deal with panic attacks in general? So how do you like? Assume I'm not in the room. How do you deal with it?
Oh, that's really difficult. Um,
Let's go by levels. The
so
low level ones. But
the level one, level twos, deep breathing. Um, I have only had two dissociative panic attacks that you have not been home for. Um, I have been home by myself when I've had those. As by myself as I can be with two dogs. And in that case, little Miss Clove has got me out of both of those.
but if you're in one of those full on like grand mal panic attack, Is there anything you can do, or is it just like your brain's just not letting you operate at that point?
Um, so I think it just depends. There are one of the things that you can always do is circle breathing, square breathing, any of those. So by that, it's you breathe on whatever shape count it is. So if you're doing square breathing, you're going to breathe in on a 4, hold 4, exhale 4. Breathe in 4, hold 4, exhale 4. And it's whatever is going to work best for you. I like evens. Um, so I always prefer to do even counts.
So it's like once you are able to be back aware of what's going on, like you just gotta find something like try to breathe, and like we'd also do the where you try to focus on the world around you, right?
Yeah. And it's just finding again in those cases like what coping skill or what coping technique is going to work for you. Um
What would you suggest we try? You got the breathing.
yeah, so honestly some of the best things that I have found for those pretty severe panic attacks, sour candy works really really well. So and one of the things that we'll do in a later podcast is we'll kind of like walk through what I call an SOS kit. It's just a little kit that you can keep in your purse of like emergency things. So like, and when I say sour, I mean as sour as you can stand it. So like atomic warheads
Lemon.
or
Well, those are more lemon heads.
that, yeah, lemon heads are great. You want them. I'm talking about the atomic warheads,
Oh, okay, yeah, 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 yeah.
the
I was
sour.
thinking of the cinnamon.
No, those are
Yeah,
atomic fireballs.
that's
Because you want things. So like when you have a panic attack and like when you get to those pretty severe ones, a lot of what is happening is you are fixated either on a past event or a future event. So what you need to do is you need to ground yourself in what is going on in the present. So candy, those sour things can help do that.
ice.
Ice can do that. Um, the things you need to be very aware of is that ice will still burn your skin. And because it numbs at the same time, it is can be very easy to not realize that you've hurt yourself. So bear that in mind. So you and again, like you can do the snapping the rubber band. While I don't recommend that for intrusive thoughts, it can be a really good grounding technique because it helps get you into the present moment.
Yeah, it's like people have a history of self harm that might not be the best.
Again, remember coping skills like anything else are not a one size fits all. You need to take what resonates, leave what doesn't. So, if you have a history of self harm or self harm is something that you're worried about, don't do the ice, don't do the rubber band. However, sour candy would work really
Or eating
well.
ice.
Eh, I mean, it's not great for your teeth, but sucking on an ice cube can also help as a grounding technique. Again, it's that idea of keeping you in the present.
All right. Let's go on to the next question there. When should you seek treatment slash professional help when it comes to anxiety or panic attacks? Like, what's the threshold there?
So
Is
that's
there a threshold or is it there?
so again, that is up to each individual person. So the way I always look at treatment and medication is when you are having a disruption in functionality of life.
So what's detrimental?
So yeah, when it's so like for example, when you're wanting to go to Walmart and the thought of walking into Walmart almost immediately sends you into a panic attack. When the thought of going to a music concert or doing things that you would in any other time really truly enjoy 110%, but the thought of right now sends you into panic.
Okay. You think I
So
have bad allergies, so I keep
yeah,
talking.
um, hemp and clove.
All right. So basically, it's when it starts to actually affect your day to day.
Yeah, like if
It's like anybody can have anxiety. Anybody can have anxiety. It's just when it's if it's like constant or affecting you a lot. Or,
yeah, um and it got to a point with me where I was, because mine manifested the worst during grad school. And I wasn't sleeping. My appetite was awful. Justin and I were fighting all the time. Over stupid shit. Not that we ever have a fight over anything important ever. But it had gotten to the point where I couldn't continue the way it was. And I started therapy and finally like talked to my doctor about it. And she's like, hey, why don't we put you on an antidepressant and an anxiety med? And I was very lucky that for the longest time, the med I was on worked. It's only been recently that we've had to do some med changes.
and so finally, tools or skills to help with anxiety when you or someone you know is having an anxiety attack. We talked about kind of what you can do, ground out, be center, all that kind of stuff. What about what can other people do to help?
So, just for other people, it's just really understanding that this is not so much of a it's not a choice. They're not faking it. They don't like understanding. I think the key thing is understanding it's not a choice. They have not decided they want to have anxiety. They've not decided that they're making a choice to have a panic attack. So things that you can do. Always ask before you touch them. Because for some people, depending on the type of panic attack they're having, depending on where their panic is coming from, it can really make it worse.
Can I go through my steps that I
Absolutely.
usually do? Um, so like general anxiety, I just try to like when you're having all those, I just try to smooth the path as much as possible. If I can take care of something that I know is going to be a problem in a minute, I just take care of it. But that's kind of normal. Like when you're having a panic attack, like I usually try to get you, I try to gauge where we are in the panic attack scale, right?
Mhm.
Um,
I would explain how you do that too.
well, the first thing I do is like, hey, baby, you there? What's going on? I try to talk to you to get you to answer and respond, and depending on how coherent and complete your sentences are, that helps determine where we are.
So you give
Like
a
no
call.
response, a couple of words, short sentences, or fuck it, I'm having a problem, blah 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 blah, and you actually go into a thing and start talking. That's a great way of determining for you.
Yeah.
Like if you're dealing with someone who has panic attacks, you got to just learn their thing.
So maybe a basic place to start would be a call and response question.
Mm-hmm. Um, I often will ask if you want me to touch you. If it's okay to touch you. Now, if you're disassociating, if you're not responding to any of those, I'm going to just go ahead and touch you.
Mhm.
But I'm doing it specifically because one, we're married. We've established this relationship. Like this has been established before. Um, and two, what I'm trying to do is just get your brain to snap back to reality. Oops, there goes gravity, et cetera, et cetera. Um, so, like I said, this is reaching out and trying to pinch you and all that kind of stuff. Um, and like get you to respond. And the thing I do most commonly is, all right, baby, we're gonna start breathing. I'm gonna do one. I'm gonna count to three, and then we're gonna breathe in. It's like I tell you exactly what we're doing because your brain's going like 1,000 miles an hour, and it's like dealing with at that point you're dealing with like a fifth grader or under. Can't give them multiple instructions at a time. You give them one instruction and then move to the next instruction and the next instruction. So very clearly, hey, we're gonna talk. We're gonna breathe. One, two, three, and then I breathe in, and then I audibly breathe in extra loud to make sure you can hear me doing it.
And because
Because
it
usually
makes
you're
you
not
laugh.
you're not able to look at it, and then I hold and I breathe out extra loud so you can hear me doing it. And usually that takes you a couple of times, a bit before you're able to breathe back in with me. If that doesn't work, I'll do the 5, 4, 3, 2, 1. Um, which is for those who don't know, it's where you say, "Hey, I get it wrong every time. 5 things you can see. I need you to tell me right now 5 things you can see, 4 things you can hear, 3 things, 3 things you can touch, 2 things you can smell, and 1 thing you can taste. Um, I especially like doing that when you're having allergies and stuff, because once we get to smell and taste, the absurdity of me asking a person whose nose is completely stuffed up what they're smelling usually helps kick you out faster.
Also, by that point, if I've been crying, because I often cry with those intensive panic attacks, I'm watery and snotty anyway. So
But the most important thing is to, like you said, it's not your fault. You didn't do anything wrong. You're not, and yes, especially like, so person's had an anxiety disorder for a while. There are times where she'll go into a panic attack and I'll be like, God damn it, not again. And I'm like, that's a, I don't like that I have that thought, but I have that thought.
you're not the only one that has that thought. Trust
But
me.
it's like, oh, this is like, oh, it's time for the nightly panic attack. Let's see what we can do here.
And to give context, why a lot of people have panic attacks at night or in their bedroom is because that is their safe place. That is where they feel safe. That's where they feel comfortable. And as you're starting to wind down to go to sleep, your internal safety, like the walls that you put up to protect yourself from everything that's going on, come down. Um, so it's kind of one of those things that it's important to realize that if you're having them more often at a specific time, there's probably a reason.
Um, Also, if you're having one of the lower level ones where you're still mostly coherent, I might have you count to 50 by threes or backwards from 100 by fives or something like that. Just something that, like, yeah, in order to do it, you have to stop and think for a moment.
Yeah.
Um,
Anything that gets the lizard brain out of control
yeah,
and the front brain in
anything, and
control.
like I said, you just gotta keep trying. The But otherwise, and then once it's done, once the panic attack has seemed to have calmed down, you kind of got to go into aftercare mode, or they're going to have another one. Like, you gotta. That's where you have to just keep your, like. You have to go into soft, even voice, talk gentle, and yes, for those of you who have a partner or someone who is having it, it's a lot of work on you. Like, you have to, you can't let your own emotions come out at that moment because you're in triage, you're in help mode. Like anybody else, you can't freak out until after they're done freaking out. Then you can have yours and have a little freak out as a treat. But like, hey, how's it going? All right, tell me what's going on. Tell me what's going through your head. Did anything specific trigger that? And when they say no, understand that that's a possibility. Sometimes it just flips the switch.
Yeah.
Or they don't know what happened. And it's like, okay, that's fine. Get them to breathing, see if you can get them to laugh, and then like just move forward, slow, gentle, and peaceful as possible.
Yeah.
Sometimes it's not possible. Sometimes you're in the middle of driving a car, but then if you can pull over when you get the opportunity, uh, and talk it out. Like I have had this happen where I've been pulled over because like I had a panic attack in a car. And like a cop was like, what's going on? It's like, look, I just need to be here for a moment. It's okay. And the cop was cool with it. You good? Yeah, give me a second. Um, that kind of thing. So, but yeah. Um, let's see. Do you have any other points you wanted to make sure you hit? Because we are over 30 minutes at this point.
Yeah, I think some of the key things too to remember is that you're not always going to know what the triggers are. Um, it doesn't. You don't always have a specific trigger, and that is okay. That's one of the things that, like, when you are if you are in treatment, or if you're doing self-reflection on your panic attacks, and by that I mean, it's like, okay, I've had a panic attack. What happened in the past couple of hours that could have done that, or what has happened today, or what happened today 3 years ago? Because sometimes things happen on specific days. Here's something else. And I feel like and I'm going to do we will do an episode on medication. But this is something that I really wanted to kind of talk about. A lot of medications for anxiety are in what is considered in the Benadryl family. So uh, um, Antihistamines. That's what I can think of. So, like for example, I take Vistaril. Vistaril is a short-term solution. But one of the things that you can do is a first generation antihistamine medication like Benadryl can be taken in a
pinch.
In a pinch.
Like it's not the ideal
solution. Yeah, it is not. And if you look it up, it's going to say it is not FDA approved for anxiety. It is what is considered as, it's called off-label. It is an off-label thing that you can do for anxiety. How that works is that it helps calm the nervous system, and it is also it is a medication that crosses the blood-brain barrier. It affects your neurotransmitters. So it can also affect things like how your body absorbs things like serotonin. So, for example, Vistaril is defined as hydroxyzine. It's an antihistamine. It blocks H1, which is a histamine receptor in the brain. Histamine can affect how the body absorbs serotonin. So, that's why often when you are on a medication for anxiety, you will be on what is referred to as a rescue medication. Vistaril used to be also called Atarax. There's a bunch of different names for it. Hydroxyzine is what those names are. And you'll be on an SSRI or an SSNRI. And those all affect how the body absorbs serotonin. SSRIs are selective serotonin reuptake inhibitors. And that kind of affects how the brain and the body absorbs those hormones. And histamine interferes with that. Again, like I said, it is not a long-term solution. If you feel like you need medication, you're having panic attacks, talk to somebody.
Psychiatrist or nurse, or you get a doctor.
Yeah. Your regular practitioner can refer you to somebody. Medication is best when done in tandem with talk therapy.
To that end, there is the National Mental Health Hotline, which is 866-903-3787. And it's 24 hours, 24/7. And they'll talk to you with depression, anxiety, et cetera, as a sort of, if you're in a moment and having a crisis.
If you ever have any thoughts of self-harm or suicide, anything like that, please don't hesitate to reach out to one of the hotlines.
You can always call 988, which will do it.
Yeah. There are text lines out there as well. Because remember, at the end of the day, it's your life. You have to make the decisions that are best for you. Medications and therapies are medication in tandem with therapy is going to be the best option. But again, mental health and medication like that and stuff, like it's not a one size fits all. It's going to be what works best for everybody.
Well, we are like 45 minutes or 40 minutes into our 30-minute podcast.
So the topic for next week is going to be, we think, different types of anxiety disorders.
Yeah, we're going to go into specifically, like we're going to talk about PTSD. We're going to talk about like the difference between generalized anxiety and like complex PTSD.
Yeah. So
et cetera.
We're going to talk a little bit more about this like differences between panic again and anxiety in more depth. So again, if you have any questions for the podcast or just in general,
Doesn't have to be about our next topic. Can be about any topic. We'll
yeah,
try to answer anything you have.
absolutely. You can reach us at Cloudy with a Chance Therapy. There is no of in the email. At gmail.com. Again, that is Cloudy with a Chance Therapy at gmail.com.
Any last words?
I hope everybody has a wonderful week. It is supposed to get warm again, and we're supposed to get rain this weekend. So if you are in the greater tri-state area, and by tri-state area, I mean West Virginia, Kentucky, or Ohio, River Valley, please try and stay cool and dry.
All right. Thank you guys so much for tuning in. We will see you next week. We think we're going to try to get these out on Thursdays.
Yeah.
And we usually record the day before. So that is, if you want to get a question on an episode, get it to us by Wednesday. We'll do our best to get on there. If it's deeply off topic, we'll hit it in the first bit and then we'll move on to everything else. But so any questions you want, and if you don't want us to use your name, let us know. Otherwise, we'll use whatever handle comes in, and unless you want to just be anonymous. Anonymous is fine.
Yeah. This has been Kristin.
And I'm Justin.
Thank you for tuning in to Cloudy with a Chance of Therapy.